back. We're going to talk now, shift over to the COVID shots. And last week, ACIP, ACIP they have a meeting every 3 months. And this was the September meeting where the first day they were going to talk about hepatitis B shots, but then they tabled that and talked about MMRV and whether those 4 shots should be given, those 4 antigens should be given together. And they decided they would not recommend that they be given together. But one little interesting tidbit from that is that really wasn't new information, because they had already recommended that if you were under 4 years old, you should not get the MMRV shot anyway. So then the second day, they talked about the COVID shots, and basically, it's a little bit confusing because earlier the FDA had sort of changed its recommendations, and the CDC's this ACIP meeting, which still has to be approved by the CDC director. But the conclusion at this ACIP meeting was that they're not going to recommend it universally as they once did. They're going to leave it between the doctor and the patient, which under normal circumstances would be great. But as we learned in COVID during the pandemic, is that we can't really trust the large majority of doctors, because the large majority of doctors recommended these shots for pregnant women and for children, and were very hostile to the patients that would not get these shots. So if you've been following me, you know that this is not enough for me. I am not settling for this. Yes, I believe that informed consent is important, but we have to make sure that we'll actually get informed consent, because I don't trust that we will. They also said that we'll have to have 6 risk factors given to the patients who choose to get these shots. And I need to go back and see what those particular risk factors are. But those will be handed out to every patient that get the shots. And, my concern is that, yes, this is informed consent. That's what we need. But these shots are all risk and no benefit. I mean, I continue to see patients coming into my office nearly on a daily basis who have persistent severe disabilities from these shots. I saw a woman my age come in last week who had 2 shots in her right arm, and now her right arm won't stop shaking, and that's been for 4 years. And she's seen multiple doctors, all who have gaslit her and will not even entertain the possibility that her nonstop tremor in her arm could be from this COVID shot. Now, she was a previously healthy person. She was a marathon runner. She was a teacher, and now she cannot work and has trouble writing, has trouble doing sort of, being her normal everyday living. So, I reported her to VAERS because, of course, none of her other doctors would do so. And this is 4 years after the fact. I got her COVID shot antibody, her spike protein antibody levels came back at 10,800, which, given that she had the shots 4 years ago and does not recall getting sick anytime recently with COVID or any other kind of virus, having antibody levels that high 4 years after the shots is not normal. What I am seeing in my practice is patients that got the shots, on average, their spike protein antibody level is about 13,000. And the patients that didn't get the shots, the spike protein level is about 1,300. And the 13,000 is actually probably an underestimation, because 7% of the patients that I tested, their levels were off the upper limit of normal for the test. The upper limit of normal for the test is 25,000. And so I'm getting patients where it is above 25,000. And the vast majority of my patients got 2 shots, occasionally 3, but that beyond that, no. So it's very concerning to me. It suggests that there is ongoing spike protein production, or spike protein that the body is unable to break down. There's a component of these shots, a pseudouridine, which we don't have a single study showing that the body is capable of breaking down pseudouridine, We have the lipid nanoparticles, which allow the mRNA to cross cell membranes. And that's why this DNA contamination, part of the reason is concerning, because if this product contains residual DNA, and it could just be a DNA fragment, it could be a plasmid DNA, and it's able to cross the cell membrane, then it can escape the body's ability to attack it and destroy it. And so it can get into the cell, it can get into the nucleus, it can integrate into our DNA, it can therefore produce abnormal proteins, it could inhibit tumor suppressor genes, it could cause frame shifting, and when Kevin McKernan gets on here, he will tell us all about it. But essentially, this was brought up during the ACIP meeting, and I think it was Pfizer, the representative said, no, reverse transcription is not a possibility. Well, reverse transcription occurs where the mRNA integrates into the DNA. And yes, it is not common, but a quick search on the internet proves that this is not correct. It can reverse transcription is a possibility. The other factor that really didn't come up during the meeting is the plasmid DNAs, which are actually, that's designed, that's how these gene therapy products are designed. They use the plasmid DNA because it's easily integrated into the DNA. And so if there are plasmid DNA in these products, they shouldn't be there. That's not safe. That's how they're manufactured, using the plasmid DNA, and then they're supposed to be removed. But if they stay within the product, then we have a big problem if they're able to cross the cell membrane, which the lipid nanoparticles, that's what they allow the product to do. They're designed to allow entry into the cell. And then if they go even deeper into the nucleus, then it can be a huge problem. Now, one thing that I would really like to see them bring up maybe at the next meeting is the cancer data, because the last time I checked, all the current cancer data that from the CDC is actually based on models and not the real data. So the last real data we have is from 2022, and that's not going to accurately reflect what's going on. And I am hearing stories from oncologists I know. One in particular is a good friend of mine who works at MD Anderson. She said she's never seen anything like it. She's seen young people with very advanced cancers, and she's, of course, no one is really openly acknowledging what's happening, but the doctors are, there's buzz going on behind the scenes. So it would be super helpful if the CDC could give us some updated information. So as soon as we have Kevin McKernan come on, we'll talk about that. Then we'll have, after Kevin, we'll have Dr. Toby Rogers. And Dr. Rogers, yeah. Okay, yeah, let's have Dr. Rogers come on. He can tell us about the bombshell news with acetaminophen. And Dr. Rogers, I just know him from X. He's a fellow at Brownstone. He did his honors thesis on autism. He looked at all the studies out there. I believe there are about 1,100 studies on autism. He weeded through them to find out, which ones we can take stock in. It turns out the vast majority of them are confounded because they do not account for vaccination status. So that's a huge one. If they lump everybody together and they don't even ask them, were you vaccinated or were you not vaccinated, then you have no way of sorting out that as a potential risk factor for autism. And he has a Substack, which goes through this in great detail. And I can't remember the name of it, but he can tell us. But welcome, Toby. Can you hear me? I think you might be on mute. I cannot hear you. I see your lips moving. No, I can see your lips moving, but I cannot hear you. Um,
I'm not
well, I'll
sure.
keep talking and wait. I heard somebody. Is that you?
We did a test.
Okay, now I can hear you. Perfect.
Oh, well, thank you for having me on the show. Sorry about the audio. I'm not sure what it was, but I'm grateful to be here with you.
Yeah, it's great to see you. So let's get right to it. What do you think? You think Tylenol? What's your thought on this announcement on Monday with Tylenol?
Yeah, so look, we've had 3 days to digest this information. And so I had some initial thoughts, and now I have three layers of thoughts about the press conference on Monday and the new policies that were announced on Monday. So can I just work through them in sort of three stages? So um, the first reaction is that Trump was fantastic at the press conference. Trump made it clear that he sees vaccines as a cause of autism. He described an employee at Trump Tower who he knew personally, whose son regressed into autism after vaccination. And he made it clear that he wants major changes to the childhood vaccine schedule to help stop the autism epidemic. So, specifically, he wants five things. He wants the hepatitis B vaccine moved to age 12. Currently, it's given on the first day of life, as you know, when the blood brain barrier is not fully formed. So, the current schedule is crazy. And he wants the
Mm-hmm.
MMR given as three separate shots. Next, he wants only one shot per vaccine visit, and he wants
Mm-hmm.
all mercury removed from vaccines, and he wants all aluminum removed from vaccines. So that's all perfectly reasonable. He is scientifically correct on every point. And obviously, we would go further, right? We would say no mandates ever because informed consent requires that any vaccine be freely chosen without any hint of coercion. And of course, we would add remove liability protection for vaccines as well. But overall, Trump went off script. He tackled the elephant in the room. He said some big truths that would get anybody else fired, and I think he moved the conversation forward. And I feel like now the onus is on Secretary Kennedy to make those changes via the regulatory process at FDA and
Oh,
CDC.
that's
That's all perfectly reasonable. Sorry, I'm not sure what happened there, but and the last point I would just say is I think Secretary Kennedy should call an emergency meeting of the Advisory Committee on Immunization Practices and have them pass all five major reforms as a package.
well, I agree. Yeah. I mean, yeah, yeah, as you know, I'm very frustrated because I thought this COVID shot situation would have been handled by now very swiftly. So what are you think you think this, how realistic is it that, and I do, yeah, it was great. Trump went off script and said a lot of things that would normally have not been said, but do you think the things will actually get implemented?
I think this is a long war. I think nobody knows what the future holds. And so we're just trying to use a sports metaphor, move the ball down the field. And
Right.
and this week we moved the ball down the field. Not as far as we wanted, but much further than we thought we might. So the point I'm at is to take the wins when they present themselves, and then also to keep our eye on the prize, to keep our eye on the goal,
Right.
which is to restore liability so that we can take the pharmaceutical industry to court, particularly vaccine makers, to prohibit mandates, to get rid of vaccine schedules. We still have our North Star. We're clear on what we're fighting for. But if we can get small wins, I'll take small wins and I'll keep pushing for bigger wins. But there's some small wins that I don't want to lose sight of from Monday as well. And let me just
Mm-hmm.
highlight them for a moment. So I thought Secretary Kennedy, I mean, he's right to discourage use of Tylenol during pregnancy. It's toxic. Nobody should be taking it. And leucovorin, it's going to help a lot of children on the spectrum. It's a form of the vitamin B9, which is folate. It's folinic acid, not folic acid, but folinic acid. And for the first time, we have a treatment with little downside that has a lot of potential for addressing autism symptoms. I'm on some leucovorin groups on Facebook, and a lot of people, a lot of parents are seeing improvements in their children, particularly around speech and the ability to
Okay.
socialize with others. So those are some small wins, but they're significant. I
Right.
mean, candidly, we had no wins prior to this week, and so these are important wins. And then FDA Commissioner Marty McCary said 4 words at the press conference that nobody else has noted, but I want to highlight here because they change everything. He said this sentence. He said, "Autism can be prevented." Now, I've worked for 10 years to get that fact into the public consciousness.
Hmm.
What Marty McCary was confirming is that autism is caused by toxicants. Now, we have to actually do something about that now, ban and restrict those toxicants. And that's mostly vaccines and about a dozen additional toxicants. But history was made when the FDA commissioner said, for the first time in American history, autism can be prevented. And then the other win I thought from the press conference on Monday was that NIH Director Jay Bhattacharya acknowledged that the surge in autism prevalence could not possibly be from genetic factors alone. And that's also a
Hmm.
first. Director Bhattacharya is the first NIH director to recognize that the autism epidemic is toxicogenic, caused by toxicants. So we're in a different space today on Wednesday than we were on Monday and than we've ever been in the history of the movement because the paradigm is shifting, and Secretary Kennedy, Marty McCary, and Jay Bhattacharya acknowledge some foundational truths that are going to open the door to a whole lot of more reforms down the road.
Well, that's a good positive spin on it. I'm actually glad to hear that because I sort of felt like, okay, they're just putting all their blame on Tylenol, and but I think you're right. Yeah, it's more significant than most people probably realize. There's been so much buzz today about Tylenol. It seems to be overtaking the conversation. But I think you've really highlighted some important things to take away from that press conference. And yes, it's interesting because Peter Hotez, his big thing is, oh, it's genetics, genetics, genetics. And I skimmed your Substack today about that situation. Tell us real quick about the genetics and why it cannot be genetics.
Yeah, so as you highlighted at the top of this conversation, I did this systematic review on my Substack, and then it was picked up by Brownstone and sent far and wide, where I did a systematic review of 1,000 studies of autism causation. And I worked through different batches of studies. So there's 22 studies that claim that vaccines don't cause autism. None of those studies has a completely unvaccinated control group. So they're not reliable. You can't figure out the causes of autism from those studies. Then there's about 500 studies of genes and autism, genetic studies. And the problem with these studies is there's no such thing as a genetic epidemic. The human genome just doesn't change that fast. Since 1970, the autism rate has increased from 1 in 10,000 children back in 1970 to 1 in 31 children today. Now, if you do the math, that's a 32,158% increase in autism prevalence in the last 50 some years, 55 years. So the human genome just doesn't change that fast. So a genetic study is never going to be able to explain what's happening with the rise in autism. And then there are these epigenetic studies that are looking at the interaction between toxicants in the environment and the human genome. And there's about 500 of those studies. as well. And they're somewhat better than the genetic studies. They're better than the vaccine studies. The problem with those studies is that these epigenetic studies that are looking at toxicants in the environment, including Tylenol, by the way, they never control for vaccines as a possible confounder or covariate. And they never look at the interaction effects between vaccines and the toxicants they're studying. And that's by design. So in epidemiology, it is standard practice to ignore vaccines as a possible causal factor. And they do that to save their jobs, and they do that to keep from getting blacklisted, and they do that entirely to keep from angering the pharmaceutical industry. So you have these 500 studies, very good epidemiologists conducting these studies that look at lots of different toxicants, about 12 different classes of toxicants. But they never look at the elephant in the room. They never look at vaccines. They never control for it. They never study it. They never measure it. Sometimes they have the data in their data sets and they ignore it. So those studies are also invalid. They're unreliable. Unfortunately, I like these researchers. I like these studies. You can't rely on them because they left out the factor that might explain everything. And then there's 6 very good vaccinated versus unvaccinated studies that have been conducted over the last couple decades, 2 by Gallagher and Goodman, that show that vaccines, particularly the hepatitis B vaccine, significantly increases autism risk. 3 brilliant studies by Anthony Mawson that show that vaccines significantly increase the risk of autism and other neurodevelopmental disabilities. And then a brilliant study by Hooker and Miller in 2021 that shows that vaccines significantly increase autism risk. So that's the systematic review that I've done, and it's been read widely inside HHS, FDA, NIH, CDC. And look, they know about this problem of confounding and the possibility that vaccines are covariate, and they know that they're not measuring the interaction effect between vaccines and other toxicants, but they are scared to take on the pharmaceutical industry, so they produce studies that are not very reliable.
Yeah, it's very frustrating. Well, okay, tell us what is the name of your Substack so people can go find this?
Yeah, so it's tobyrogers.substack.com, and I call it Utopian, which is a play on the word utopian, but uses my name Toby. So it's Utopian. It's tobyrogers.substack.com.
Great. And you are a fantastic follow on X too. You're pretty snarky and funny. So thank you so much.
Thank you.
We will we'll have you back soon to get an update. And when we come back, we will talk to Kevin McKernan.